Welcome to the 2017 Early Head Start Child Care Partnership webinar. Thanks for joining us today. We're going to go over Early Head Start Child Care Partnership for the coming year. And we'll quickly introduce ourselves and get started. We've tried to upload onto the webinar some documents for you to download, so you'll have them and you can take notes on and follow along. Hopefully that has happened. I'm Beth Stover with Children's Services Division.
Good morning, everyone. I'm Glenn Lazan, Director of Accounting for DFSS.
Good morning, everyone. I'm Madeline Hania in Children's Services.
And then
Victor Santiago.
Darlene Jones-Lewis.
Key Guan.
And they are all off camera, but they are here with us now.
That's right. That's right. So Madeline is going to send us off.
So good morning, everyone, again. And what I wanted to do was kind of an overview, a review of program requirements for the partnerships. And so next, program requirements. Okay, so just to go over the agenda, we're going to go over the program requirements. Then Beth will go over the grant application, and then we will talk about the roundtable expectations. Okay, so first up on our agenda is the program requirements, but just talking about the program goals, reminding everyone why this partnership grant just came to be. It was to build a lasting foundation for high-quality early learning opportunities for infants and toddlers through this Early Head Start Child Care Partnership grant. And most importantly, to provide comprehensive services and high-quality early learning in a high-quality early learning environment for low-income working families with infants and toddlers through layered funding. So just going over some of the key program requirements for the partnership, I wanted to talk about comprehensive full-day, full-year services, staff ratios, staffing and planning shifts for staff, staff qualifications, child care subsidies, partnership agreements, and citizenship and immigration status. So for comprehensive services, everyone knows that this grant was intended to operate a full day, full year. By full day, this is meant that we need to accommodate the needs of full-time working families by providing services for a 10-hour day. When we say full year, this grant is also needs to accommodate a full year program that is typically child care. So just like child care services throughout the year. Next, staff ratios. So the child care center group sizes for this partnership grant is the Early Head Start ratios of 1 teacher to 4 infants and toddlers, and group in a classroom of no more than 8 children. Family child care group sizes are a little bit different. The maximum group size for 1 qualified provider is 6 children with no more than 2 under the age of 2, or a maximum group size of 12 with no more than 2 younger children than 2 younger children over 18 months, cared by 2 caregivers. So that would be a provider and their assistant. Staffing and planning shifts for staff. So because it's a 10-hour day, additional teachers will be needed to cover the full hours of operation for those 10 hours. So we know that this has been a really big challenge for our delegate agencies, and we just really need to implement a staffing structure that meets those requirements. We are here to assist you to developing that, but that is the intention of this grant, is to provide a full day, full year services for infants and toddlers for parents that are working or in school full time. Staff qualifications. All partners should have a professional development plans for all staff. Teachers and family child care providers must have a minimum of a CDA with a focus on infant toddler development or equivalent. So the equivalent would be anything comparable to a state credential. Child care subsidies. Is it 25%? So 25%, according to the grant, 25% of funded enrollment with child care subsidies. So these are, again, program requirements that 25% of your funded enrollment are children that have child care subsidies.
We'll double check that.
And subsidies can vary. There are different sources of subsidies that we can count that towards, that percentage. So it's either your child care, your state, local, or TANF. Programs, this is really key. Programs may not disenroll otherwise eligible children from programs because they lost their child care subsidy. Early, and most importantly, early Head Start child care grant funds can be used to cover the temporary cost of lost subsidy and the continuation of services. Partnership agreements. Two key points in regards to their agreements. Written agreements, all agreements must detail the programmatic and fiscal relationship between the delegate and each partner. And also, this agreement must include a requirement that continuity of services and relationships must be preserved and that the child should remain in the current care setting and classroom regardless of loss of subsidy. And lastly, citizenship and immigration status. Verification of citizenship or immigration status is not required for any of our children enrolled in the partnership program. And next up is Ms. Beth Stover, who will go over the grant requirements.
Right. Well, I'll begin to go over the grant requirements with finance a little bit. You should have, hopefully you've been able to download the program instructions, the tables, and the budget. Most of these forms look like they have in the past, but we've made some changes in our process. So we're anticipating that either by the end of the day today or tomorrow, you should be getting your funding letter, which will have the written instructions as well as the final version of these documents. As you all know, we have webinar or roundtables scheduled for the week of the 6th through the 14th. And so we'd like you to bring in these documents and your draft of them so far. And the final draft of them are going to be due on the 21st of February. All of this will be in the funding letter. And then the final signed documents, once they've totally been reviewed and approved, will be due on March 3rd. So that gives us, about a month to get this together. So let's turn to the program instructions. Victor, the stage, please.
Is it on this one?
No. There.
This one?
Maybe. Nope. Nope. The third one. Yeah. Try the one on the very bottom. That's the budget narrative there. Try that. All right. Yeah, keep it up like that. That's good. So one of the things that we've done this year is that we really worked on improving the instructions, trying to get a full comprehensive view of your program and have it in the grant narrative. This is something that the feds asked of us, and so we're kind of passing this down to you all, and it will help with the roundtable, because at the roundtable, we'll get into what's going to happen at the roundtables in a little bit, but it's going to be, you know, much like the roundtables you've had in the past, where your performance, your program performance, program needs, et cetera, is discussed, and we want to make sure that that's all captured in the grant narrative. Many of the questions look the same as they have in the past. In some cases, we'd like more details. You can cut and paste from management plans and from other documents you have to fill in some of, respond to some of these questions. And in other sections, we've provided you with table templates for you to complete. So the information is really handily available. So for example, in section 1 is about your program goals, and everybody has submitted program goals in the past. We would just like to have them resubmitted here according to the table we've constructed, table 1. And maybe now you can pull up that table sheet, Victor. Yeah, the one before. Yeah, that one. So if you look at the top table, the goal, the objective, how you're tracking it, what your current progress or current update on it is, the rationale for that goal, especially that rationale if there are changes. Usually the rationale is, as you know, based on your self-assessment, your community assessment, your understanding of the needs of the children and families you serve. And then in most cases, I think that everybody has already submitted goals, and so they're continuing goals. But if there are any changes or any new goals, please indicate that there, right? And then table 2 from this section as well is this encapsulation of your school readiness goals. And I think many of you are basing them on our goals, which are fine. You can put those in there in this thing, but give us the update, the progress about the children that you're particularly serving, right? Based on your, I guess it would be winter checkpoint probably has been completed, right, Madeline?
Yeah.
So that's section 1, program goals. Section 2 is about service delivery. Can we go back to the, let's go back to the narrative for a second before. Again, here we'd like to get some more information about the area you're serving and the community assessment data about the particular areas you're serving. You know, some of you or some of your staff participated in the community assessment focus group we had. And so we're working towards taking those suggestions and integrating them into the grant application process. One thing that we're going to be doing for the fiscal year 18 base grant is relaunching the community needs assessment tool that perhaps you all remember from the Ready to Learn applications in 2012, where you were able to put in a particular address and get a reading about all the families within a 2-mile radius of that site. That is not going to be ready until March. But in the meantime, we have uploaded all new data into the 2 Chapin Hall websites, Early Childhood Supply and Demand and Young Children in Chicago. And so you can use that to fill in some of the information about the children and families you're going to be serving. So one thing is we'd like a map of your service areas with boundaries on it, and we'd like you to describe those service areas. You can list that out by site if that works for you. And then we'd like to know about the children and families you're serving. And there is some tables attached to this section. So can we move to the tables so we can look at them? Scroll down, next page. Okay, so please, for each site, fill in a line that indicates what community area it's in, the address, and then you can use that tool to fill in the number of children under age 3 in the different poverty categories, 0 to 50% beneath the federal poverty level, 51 to 100% beneath the federal poverty level, and 101 to 185% below the federal poverty level. The eligibility, the number and percentage, so those two symbols are number, the pound sign, and percentage of children eligible for both CARE and CCAF, and then the number of children who are eligible for CCAF only within that community area. So you should be able to, I'm sure many of you have already done this many times, you should be able to go to the Early Childhood Supply and Demand website, look up your community area that your site is in, and find this information out. It's still, because we're dealing with, this is by community area, so for this grant application, the area, the service area is a bit larger. For the base grant, when it comes up, we're going to be narrowing it down a little bit. So that's about, table 3 should be filled out with the information about the children under age 3 and where they fall according to those categories. And then in table 4, we'd like to know how you're allocating the slots across those sites. So every site in table 3 should also have a line, a site line on table 4, right? So it may be that all your early Head Start Child Care Partnership children are at one site, in which case, great, then only one on each line. If they're at multiple sites, then we want to know each site how they fall. And then we want to know just a sentence or two about the rationale of why you allocated the slots as you did. This is the sort of information that the HHS is more and more concerned about, and we are too, as we try to put into place systems that will address some of our under-enrollment and some of the work that's going to happen with alignment, and understand where we need to put certain sorts of slots to ensure that we're maximizing the dollars and the services for the children and families in Chicago. And I think that's it for this section. So then if we can go back to the narrative, Victor. So then you'll see URSIA, or URSI, depending how people say it. Please provide a copy of the selection criteria, especially that includes this particular grant. If there are any changes, please let us know. If not, just say so. The dates when you when the governing bodies approve the selection criteria, and then we'd like to have a snapshot of your attendance during the past year, so we can look at that. And that would be the URSIA section, and I don't think there's any tables attached to it. So then the next section is health. Again, this is just letting us know how you're doing and what you're doing as far as ensuring that the children and families receive their health services, especially if there's any sort of collaborations that you're doing locally. C is the mental health consultants that you have, just list them out. If you want to put a table in there, you can. We didn't want to over table the application, the narrative. So number 5 is education services. We'll ask you about the research-based curriculum you're using, if there are any changes, any strategies you have to improve teacher quality. And then table 5, Victor, can we go back to the tables for just a second? Table 5, there we go. We wanted to know some aggregated information about your teachers and their qualifications. You can see there, and your managers for education. And as Madeline said, everybody's aware of the requirements. And we'd also like you to submit, we can go back to the narrative, Victor. We'd also like you to submit the staffing plan that was due, I believe, today to Anya.
Yes.
So that should be included with the narrative and should be brought to the roundtable. So all the documents, tables, etc., please try to complete as much as you can to bring to the roundtable. Let's see, education services. Any coaching or mentoring initiatives you have that you're participating in. Services being provided for children with disabilities, and then in Table 6 we ask about your funded enrollment and the number of children who have an IFST, who have had a diagnosed disability. So that would be the education section. The next section is family services. We'd like to know what sort of parent education curriculum is being used. Some information about that, and then for Table 7, an aggregated list of the family service supervisors and family advocates or family service workers and their qualifications. So that's simple enough. And then Section 7 is about transition, the protocols you have for transitioning children. I think a lot of this you should be able to get from management plans and the like. Then we have this section on school readiness, discussing any changes that have been made to your curriculum, to your child-teacher interaction tool. For many of you, there won't be any, but if there are, please let us know. Number 5, we wanted to know some information about your child outcomes data and any trends that you're seeing, especially in your local agencies. We want to get better at figuring out what's happening in different areas of the city and focusing our attention, our TNTA strategies, in order to meet particular needs of particular communities and particular agencies who are working in those communities. Okay, so school readiness, child outcomes analyses, that's in this section, and I think that the only table that gets referenced is if there are any changes in Table 2 about school readiness goals. Number 4, Section 4, Parent, Family, and Community Engagement. Some information about the sort of work you're doing with family and community engagement, the data attached to that, some information about that, how you communicate with families, policy council, and the board. Section 4, and then Section 5 is about governance, organization, management structures, and oversight. So some information about your board. We'd like a current org chart of your agency. We'd like to know information about the 3 main executive director, chief fiscal officer, and your program director for Early Head Start Child Care Partnership, who might be the same program director for anything else. If you need to, none of this is going to be locked, so if you need to add an extra line, if there's somebody else you want to include there, that's fine. Describe the monitoring system. This is number 5. Describe the monitoring system that your agency employs to ensure that its daily operations at all centers, family, child care, home, and home-based models are consistent of services of high quality. So that's sort of a general overview of your monitoring system we'd like there. But then when we get into Section 6, there's some particular questions about working with partner agencies and the Early Head Start Child Care Partnership grant. So many of you have partners for this grant, some of you don't, but certainly we want you to be responsive to this section because we want to get some more information about how the relationship with your partners is working. So in Table 7, we just need the names and addresses of your partners, including their lead person, their site director or the executive director, CEO. And we'd like to know how many years you have been in partnership with them, contiguous years. So how many years in a row, right, that you have been with them. Maybe it hasn't always been Early Head Start Child Care Partnership. Maybe you have a 10-year relationship that includes Head Start and Early Head Start, because obviously the Early Head Start Child Care Partnership grant has not been active for that long. But we'd like to know if there's a current contract in place, if there's any anticipated changes. The number two, what we'd really like to know, and I think that the feds are very interested in this as well, given some of our conversations with them, is that how are you designing the program to ensure that all of the program service areas are delivered to those children? I know that different agencies have different structures and systems of ensuring, for instance, that health services occur or family partnership agreements occur. And so how is it that the work is being divvied up, I guess you could say, with the partners? What is it that they are doing and what are you doing in the partnership? So sort of an overview of that. And then number three, how is it that you're monitoring the partners especially, right? So if the question about monitoring in section 5 is about this general overview of your monitoring across all sites. The one here on number 3, 6.3, is particularly about the partners. And it may be it's the same, and it may be that it's different. So you can respond accordingly. And then section 4, there's going to be a budget narrative that's due with the grant that Key and Glenn are going to go over. But we wanted to ask a few particular questions about the fiscal relationship with the Early Head Start Child Care Partnership, which is we want you to describe how you figure out what the budget looks like for your partners. Again, how do you monitor to ensure that costs are reasonable and adequately documented, and that partners are paid in a timely basis? What does that process look like? What sort of program and fiscal reporting do your partner agencies provide you with? And it may be that this is in the boilerplate contract or in the particular contract you have, and so you can take some of the language and summarize it here and then refer to that document. I think what we're trying to accomplish with this comprehensive grant narrative is this comprehensive overview of the program and how it operates at your agency. So kind of keep that in the back of your mind as the objective when you're going through and answering these questions. We want to know if you require a non-federal share of your partners, and if so, how do you calculate it and how do you monitor it? And then we want to make sure, we want to know for your partners, if children that are enrolled in your partner agencies experience a loss of subsidies, how is that reported to you that you know, and then how do you ensure that that partner has sufficient funding to provide those quality services that need to happen? Like, how is it that you ensure that without the loss of subsidy funds that they're getting, if they lose their subsidies that they're using to pay for the qualified teacher in the Early Head Start Child Care Partnership classroom, how is it that that loss is communicated to you, and how is it that you're ensuring that they have sufficient funds to make payroll? Which may also involve asking us, because we're the source for additional dollars if needed for loss of subsidy. So we'd like to know how that relationship works for you there. So that's the program narrative piece. Like I said, this is sort of we'll be using a modified version of this for fiscal year 18, so we're kind of working towards it. And you know, certainly I'm the contact if you have questions about certain things, about particular questions and the like to ask about. So then the next part that I go over was the program schedule. And did you download that, Victor?
Yeah.
program schedule hasn't changed, and luckily for this grant, it is pretty simple because there's really just two options: center-based, family child care home, and services have to be full day, full year, 10 hours a day. So there you go. This is not the one that will be sent to you, but it looks basically the same. Let's see if we can bring this up. Right. So this is from fiscal year 13, but the one that you'll receive in your packet will essentially look the same. The only thing that'll change is the date. You have whatever your funded enrollment is, and they have to be in either center-based or family child care homes. Yeah, so either you put, let's say, 8 children. Oops, can we go back to that? 8 children in center-based enrollment. Here, Victor, can you go to that top and let's fill it out? Yep, 8. Let's put an 8. And home-based, let's say you've got 10. So there you go. There's all the children, and so we go down to the program schedule.
Why have 10? Home-based. There's no.
What are they going to have? 12?
No, in home-based there's.
Oh, not home-based. I'm sorry. Family child care home.
Family child care.
So let's put 6. So program option identification, let's go to the first column, CB, 8, underneath CB, funded enrollment is 8, number of classes, groups, family child care settings would be 1, is not a double session N, 10 hours a day, 10, 5 days a week, 5, you'll get the chart that says how many days per year. I think it's like 240. Yeah. 240 to 248. Victor? Number of home visits per child per year is 2. Hours per home visit is a minimum, I think, of 1.5. So that would be that. And then the next column would be where your family child care home goes. So FCC, 6. So let's say you have those in 3 family child care homes, and then it looks exactly the same. No, not double session. 10, 5 days a week, 240, maybe it's 245 days a year, I don't know, 2, and 1.5. Voila. Say the program schedule. Good. So that would be the program schedule, the narrative and the program schedule. Like I said, please bring as much as possible with you to the round table. Especially start working on the tables so we can go over those. And I'm going to now kick it over to Glenn and Key about the budget and the budget narrative.
So Victor, if you'll please pull up the Excel form, the blank of the budget, that would be great. Yeah. So if we go to the cover page, the first tab. Okay. So on this page, we'll walk through the Excel workbook here that you will receive. As Beth mentioned, you'll receive that either later today or tomorrow morning. Most of you will note that this format, as we go through the separate pages, is similar to the format that you've seen previously for base grant or for partnership. There's been some changes, modifications, things along those lines, but it's, again, not something unfamiliar to you. It hasn't been totally revamped or anything like that, so hopefully that will help you in the process. So again, on here is your agency demographic information, name, address, chair, things along those lines that you're very familiar with filling out. In the middle, the estimated funding that will flow through the subsequent schedules in the workbook. At the bottom is a checklist of the forms that you all will be completing. This will be reiterated again in the funding letters that will go out to you. But again, bringing as much of these to the roundtable as Beth mentioned would be very helpful, because it'll help us to go through that, troubleshoot questions and issues that may be simple or maybe more complex. But again, these would be roundtable discussion items, and in addition, there'll be the draft version that will be electronically submitted a little bit down the road, and we'll go through that too. So Victor, if you go to the next tab, the 424, that is the summary of your federal and non-federal funding, along with other pertinent information that will flow through. This also calls for the signature of your board chair and parent policy committee chairperson. Again, the form that you're all very familiar with. If you go to the next tab, Victor, please. Other sources of funding. This is one where and we'll detail this a little bit further when we go through the example of the budget narrative. But we're asking for the separate segregation of the different funding that you may have. Again, we'll talk about this a little bit longer. We'll go to the next tab, Victor. Another very important schedule, this is Form A. We've just retitled it for this year, but we're asking everyone to list out for every one of their contract that they have with their partners this particular information. So this will be very important for us. And again, also too, as you'll see from your funding letter, we'll be asking for examples of your boilerplate contract, as well as a copy of every contract that you do have with your partners. Okay, Victor, if you go to the next tab, please. There's personnel. Yeah. So on this one, again, very similar, breaking out the staffing into the 4 categories that most of you have already worked on previously: child health and development, family and community partnership, program design and management, and the infamous other personnel, with additional lines for any add-ins that may be applicable. The similar information that you've done in the past with salary data, computation of the non-federal portion, the number of FTEs, project cost, percent admin, total admin cost, and other sorts of funding. Again, a form that you've seen many times and are probably very familiar with, unless you're new to the particular organization. We'll walk through these again when we go through the narrative. Next page on there is fringes and other expenses. So again here, fringe costs, Social Security, insurance, travel costs, equipment, supplies, your contractual items, and then other expenses as applicable, rent if you are paying it, utilities, telephone, and various other expenses that are unique to your particular agency. The rest, the bottom of the form is flow-through computation. The next tab, Victor, is summary of the particular line items: personnel, fringe, travel, equipment, supplies, contractual items, construction, a more rare item, and other expenses, and summarizes all of those items. And last but not least is the 424A form, which brings together all of the expenses from the prior worksheets into here for a summary along those particular categories, and again splitting it out between federal, non-federal. So forms that you're very familiar with, there's not change to this other than maybe 1 or 2 items, but even then that is somewhat unique. Victor, let's move over then to the Word document, the budget narrative, which has the yellow bar highlighted. Okay, there we go. So this will be a format that you may recognize that we used last year for the base grant, and we thought it was a very good guide. Our responses were great from everyone as a tool to walk you through meeting the 14 categories that are mandated to be reported on in your budget narrative. So we'll walk through this and take it from there. So you'll be able to replicate something like this for your particular agency. Again, just the header on here, speaking of your agency name, that this is the FY17 continuing grant application. As we know, the project period covered is July 1st, 17 through June 30th of 18. But in terms of how the grant years fall, just we all have to stop and think about that for a minute, is that it represents really the year that it starts in and where the funding falls. So it starts in fiscal 17 that we're in, and so that's why sometimes we may, in accounting, look at the date of June 30th for your financial people out there and say this would be FY18 for the accounting year end, but it is FY17. So as we'll walk through these 14 sections, Section 1, the budget justification narrative, speaks to the salaries. So there's a little bit of introduction narrative here, again, particular to your agency to be completed. Then we'll walk through the personnel. As you remember from the Excel budget that we just walked through, this asks for you to detail out all the specific areas: program managers, teachers, family child care personnel, home visitors, and again in this narrative completing out the cost, the non-federal match, total number of employees, and total FTE, separating the difference between and asking for an attestation statement that all wages meet or exceed the minimum Chicago rate of $11 an hour. Again, followed by some narrative here asking for a little bit of detail as to the responsibility of each of those staff in their particular areas. The next section is back to the budget, is the second of the 4 program areas. So family and community partnership personnel addresses program managers and content area experts and parent engagement coordinators, again asking for the same information as the prior one, and narrative regarding their particular responsibilities. The next section is the third of the 4 personnel sections: program design and management personnel, executive director, early Head Start Child Care Partnership Director, clerical and fiscal as applicable, again asking for the same information and a description of their tasks and responsibilities. Then the other section would be the other personnel, the last of the 4, asking for the same information and a description of their responsibility. The second page, as you remember, of the numbers on the budget worksheet then calls for a detail of fringe benefits. So here we're asking for a narrative addressing the detail behind your particular fringe benefits, the calculation of them, and estimated at X% of total salaries. So again, listing out your particular benefits that you have and what's being charged. Non-personnel, this is the continuation of the second page of the numbers section of the Excel budget. This is detailing out your travel, and again, it's customized to be specific for your individual agency, but asking that you provide as much detail as possible here in the narrative, because these are going to be reviewed as they have been for the base grant and for the prior one, but they will be reviewed in detail when we do submit these for HHS. So please be as specific as possible, especially with these type items. Equipment, again, as applicable, whatever there might be, to list that out. Supplies, self-explanatory, but again, dollars and a description. And really in a description, more is better than less, because sometimes something can be stated very succinctly and maybe it's just enough there, but if something is complex and involved, don't be short on words. Put more than less, because again, when the programs are reviewed, and they do review every single agency, more will help them and minimize questions, as well as minimize our follow-up back to you for further information. Contractual, again, listing out the detail between whatever those items may be for your particular agency. Another section here, EHS CCP partners and home providers. This is just asking for, as you can see, partner name, detailing out the number of slots for them, federal, non-federal, and total costs. And other contracts. Other costs, again, the multi-line section at the bottom of the Excel budget for any of those particular items.
Scroll down. Sure.
Indirect costs, again, speaking to this part, if where you have an approved rate, please be sure to include a copy of that agreement if that is the rate you're using. And the next section, then we'll go to number 2, is budget alignment with program objectives. So this is a very important part, because numbers are one thing, but the numbers have to meet what is in your program objective and what's being discussed in your program narrative, because again, when we're reviewing it as well as when it's being reviewed after we submit them, they're going to look for that alignment. They're going to look to see, okay, are you presenting a budget that is really reasonably reflective of your staffing, of what you're going to carry out in your goals? And they'll look for an aberration and say you can't do this on X number of FTE, or that your benefits are out of line. So there's a lot of detail that will be reviewed. So that's why we're, again, emphasizing that you comment specifically or review these items as need be to make sure that that all these points are covered. Again, on the next page, Victor, if you scroll down a little bit, again, detailing out any conferences very specifically in this example, and that's something that they do want to see. Item number 3, budget and service delivery alignment. Again, speaking to what I just mentioned a little bit ago, that providing a narrative of how you will be carrying out these items, how your costs will be reflective, and prudently so, of your goals and your program. So again, that's just carried out between number 3. Number 4, there is no cost of living narrative that you need to complete. Your funding letter, the funding per slot, will be reflective of last year's rate increased for the COLA award that happened last fall during 16. So that will reflect the cost of living adjustment for everyone. Item number 5, financial management, property management, and internal controls. Submit a copy of your fiscal and procurement manual. A lot of you, depending upon how large the items were, many of you did submit to us, but not everyone, I have to say. Even though we did require it or ask for it, a lot of you submitted large documents regarding your fiscal policies and procedures and had questions, specifically even that came to me that said, Glenn, you know, should I submit something like this? If you've done it already for the base year, and if there's been maybe some modifications or some changes, that would suffice from a reality standpoint, but we can't make that determination. We need to have the guidance from you to maybe attach something unique or whatever it might be. But again, that would be your determination to make sure that you're in compliance with this requirement. The delegate agency legal name has active insurance policies, again addressing those administrative requirements. Head Start program uses funding from USDA as primary source, again an attestation here. Going on a little bit further regarding your property management system, how you may be tracking the assets in your organization, and again, that could be unique to each of your organizations. Number 6, discussing primary sources of your non-federal share portion that you'll be including in your budget. And again, as an example provided here, but yours, as both Madeline and Beth touched upon, will be unique to your own individual agency and need to be detailed out as appropriate. Your volunteer time, again, this can be very involved or it can be very simple, and again, reflective of how your agency operates. But please do detail out so that the dollars equal what you've submitted in the budget. One of the things that was particularly noticed when it was reviewed, one might think it might be something simple and straightforward, but just even math cross-check to make sure that your narrative is equaling what you've put in the budget. Because there were some instances where very minute things, but even a multiplication may have not equaled the final number presented, but yet you knew what you wanted to put into your budget worksheet, but maybe it was off by a few dollars. Sure enough, when it was reviewed, those points were brought up to us that these were not aligned with each other. So you need to be very meticulous and make sure before it's considered your final version that the narrative is in alignment with the dollars. The next section, Victor, if we can scroll down to 7, administration limitation. Again, it's self-explanatory there. Number 8, other sources of funding, as we spoke about a little bit earlier, and when we were looking at the budget, the Excel version, discussing what particular source may be applicable for your own agency, listing that out. Number 9, a copy of your cost allocation plan. Again, this is something where we will need this because issues come up, and maybe something even comes up during the course of the year where you present a budget modification to us or some type of item for our review that we do need to refer back to this to see how costs are being specifically allocated, as well as for this budget too, up front to see how you're charging the expenses to this particular grant. Item number 10, depending on how your agency entered number 2, the following are suitable for this section. Again, just talking about the use of the de minimis rate of 10% versus your own approved indirect cost agreement. So it's kind of redundant to an extent, but it's something that's needed, bureaucracy. Number 11, special situation reduction, probably not applicable. Conversion, not applicable here in this section. Conversion we did address when we did the base year grant, so that was part of our process. Construction or major renovations, this application is not construction. Number 14, your particular procurement methods for equipment. Again, another attestation. And that is it in a nutshell. Easy to discuss and walk through, but will take some time in your preparation and moving forward. So we will be here to walk you through those items. Another thing is the program governance, and the approvals. Along with the items that will be emailed out to you will be the forms that I mentioned earlier when we looked at the checklist. It'll be the ones you're familiar with the parent council approval, it'll be the board approval, it'll be the tax certification, it will be those forms. And in addition, we're going to provide a template that was asked for last year, but you had to write a letter free asking you to attest that your board and your parent council were involved in the preparation of the budget and in its review and approval. So again, a form that's just mandated. We'll be giving you a template of that. So hopefully that'll make it a little bit easier for you.
Right, and those need to be signed by the chairs. And just remember that you need to ensure that the minutes for both the board and the policy committee meeting where the grants are discussed are included, and that they reference the correct date and the correct grant. And that's fiscal year 17 Early Head Start Child Care Partnership Grant. So I know that there are some questions. We also wanted to talk about the expectations for the roundtable. Do the questions seem like we should answer them now, Victor, or should we wait till the very end?
We should probably wait till the very end.
All right, let's wait till the very end. So one of the things we're aiming for this year and moving forward is better integration between the finance side of the house and the program side of the house. So for these roundtables, the objective is going to be like the roundtables that the programs have done annually. I think, I don't even know how long they've been going on for, but to review the grant performance over the past year, to review the expectations for the coming year, but also we want to take that opportunity to go over the program narrative and the budget with you and plan them and ensure that they're coordinated and that they make sense. And that there's sufficient dollars to cover what your agency needs to do business. So review performance, review expectations for coming year, plan program narrative and budget, and also answer any questions you have moving forward. So we definitely want you to come having thought through some of it. You know, I know that the program people need to take a gander at the narrative instructions and start pulling together those documents, doing some cutting and pasting, maybe doing some actual original writing, and that the budget people are starting to work through the budget piece. So the participants for the roundtable on our end, from the grantee end, there's going to be a representative from programs, there's going to be a representative from finance, there's going to be a representative from grants, and we're probably going to have a program consultant who's going to help us with some of the review of the grant applications. So that's who's going to be there from our end. From your end, we want to make sure you bring both a program person who's knowledgeable about the program and who is steering the ship, and somebody who's going to be working on the grant application, because if there's corrections needed or additions, you want to make sure that that person is aware who's doing that work, that what's expected. And we want finance too, because we want to be able to talk about the budget and the program narrative and ensure that they align correctly. So that's for participants. So what you should bring along with yourself is the draft of the program narrative, the staffing plan, which is supposed to be submitted today, budget narrative, your winter child outcome report if it's ready, anything, or the final one from last program year to be discussed this year. So your self-assessment, so the one for this year probably won't be done, from last year, your improvement plan from last year, documents such as that should be brought with you to that meeting. So everybody was sent out an agenda or a schedule about their time to come in. So the agenda for the roundtable, to give you an idea of what we'll go over, it's a 2-hour meeting, or it's scheduled for 2 hours. So there'll be a review of your previous program year, correct, Madeline? So we'll look to summarize and identify the program's strengths and challenges for the Early Head Start Child Care Partnership Program, outline expectations for the coming year, anything that the program staff sees on our end, what you see on your end, review the grant documents, drafts, and make recommendations and answer any questions that there might be, and review due dates and ensure that everything is going to be submitted in due time. the other thing about that is to recall that this is kind of a dry run of what we're going to be doing now for the base grant as well, which is even more complicated. And so lucky Early Head Start Child Care Partnership Delegate Agencies, you get to be sort of the, we'll work it out. So we also want to, as much as possible at the same time that we're actually going through this process, you know, think about what's working and not working and make recommendations for the base grant process. You know, we want this process to be work for you and help you with your program planning and ensuring that the budget and the program is aligned, and we want, obviously, we want to make it to work for us as well so we can better serve you and that we can better provide TNTA. I know that one thing that we're working towards doing here is instead of having blanket TA and TA for everyone is to acknowledge different agencies and different programs have different strengths and weaknesses. And so we can target some of the TNTA and some of our support in ways that really work with what you all need and not just have blanket requirements that way. So that's the roundtable expectations. They begin on the 6th of February and go through the 14th. So happy Valentine's Day.
Timing is everything.
So.
Also, oh, I'm sorry.
Yeah, go ahead.
You'll notice that when the funding letters do go out today, that we're asking everyone to send their electronic versions of their required forms to a central clearinghouse email address here for DFSS that we're in the process of establishing. So that'll be contained in your funding letter. Will all the appropriate staff, the folks that are here in this meeting, will have access to that. So we'll be reviewing our particular areas of responsibility. And also in your funding letter, as in prior ones, it'll list out who your contact person is for any questions. But of course, you know, we all work together as a team. So it'll just list out for funding, for fiscal questions, for programs, for others, to refer to the appropriate person. So that'll be in your letter that you'll be getting.
Okay. Questions?
We have a few fiscal questions for Glenn. How do we set aside funds for loss of child care subsidies in the budget? Does distribution of child care subsidy losses have to be pre-approved in the budget?
Good question. Oh, I'm sorry.
It's a two-parter about does DFSS have a recommended format that could be used to determine loss of subsidy determination?
I think that, if I'm not mistaken, I've gone through, I wasn't here last year when the budgets were prepared, but you were asked to put together a line item in your budget. It's a great question. We don't have a recommended format at this point in time. It's not that we can't work towards something like that to help you and assist you, but we don't have a recommended format at this point. Again, as we mentioned when I went through the budget narrative, it's really upon you to go into, and Beth touched on this too, to go through how, if you feel that you may have an exposure there for the loss of the child care subsidy, to detail that out. My recollection throughout this year is, unless it didn't reach our office, very fortunately that one or two agencies were up against that situation, but not more than that. So I may be wrong on that, but it was a good situation that didn't happen. Hopefully that's the case, but that's something that we would still have to talk about in terms of a suggested format. We don't have that in the guidance that we'll be sending out to you today.
One thing we were talking about, maybe one thing you would want to do is look at fiscal year 16, I guess it would be the last year, and to see how often it did happen that there was a loss of subsidy, what that amount looked like, what percentage of the budget and things like that. And that might be something that you might want to include in the narrative so we know, and so we can discuss it more when we have the roundtable situation. So if you have a certain if you can do an analysis of last year and see how it impacted your budget, and then come to the roundtable with that information, we can discuss strategies at that point.
That's a great point.
Because the opportunity is there, and we can work with you to figure out the best way to cover that and prepare for that, depending on what your data shows the need was last year. We can kind of project forward.
Can Glenn clarify what additional funding sources can be used for cost sharing and non-federal share?
That I don't know, because it's self-explanatory, at least in here, I thought, with what's detailed out in the instruction that we've given everyone. So off the top of my head, can you speak to that?
So I think that typically, there's the typical sources of other funds, which is sometimes preschool for all funding is used, sometimes the USDA, child care subsidies, private funders. So, there's a whole array of additional funding that your agency may use. Volunteers. What can be counted as non-federal share, of course, is more limited, and there are particular instructions for that. We do know that child care is something that we haven't been able to use as non-federal share for many years now. But other things are available to be used towards non-federal share. So you should just follow the same guidelines you've always followed for that, I believe. Okay.
Points of clarification from Elaine.
Yeah.
File all child outcomes report to the roundtable. The winter checkpoint is in February.
All right.
So the fall outcome
Right.
report.
Or you can use your, you might also want to consider, this is something that we've discussed with the feds for us as well, with the new sort of comprehensive look at the program that the feds are wanting to see in the grant application, and that we're wanting to see from you. There's ongoing activities that happen, and the fiscal year when the grant is due doesn't always fall in sync with the end of a program year. So it may be that you want to, we haven't come up with we don't have a particular recommendation yet. We might, in the future, you may want to bring your spring outcomes report for Early Head Start Child Care Partnership from last year,
Right.
because that would be the last complete one for the grant, and that may give you more useful information for planning for the coming year than your baseline fall outcomes. That only tells you sort of what the baseline is for this year. It'd be maybe more helpful to know where your children started last year and where they ended up by the end of the year to figure out what sort of planning you want to do for the coming year. Yeah.
Makes sense.
All right.
That's it for questions.
All right, and so we will be sending out the funding letter with complete instructions end of the day today or tomorrow. If you have questions, again, like Glenn said, there's Madeline for programs. You can contact me about the program narrative. You can talk to Glenn or Key about the budget. You can reach out to Jackie, Darlene, Jones-Lewis, especially about particulars about what to be submitted for the grant application. Oh, there they are. Yay! So you know us all. So, and I believe we're recording this. Yes.
Yes.
So there you go. Have a great Monday.
Yes.
Thank you, everyone, too,
Thanks for
your registration and to participate.
Yeah.
We're glad we have such great participation on this, so that's very helpful.
Thank you.
Thank you.
Bye, everyone.
Bye. Bye.